TV News, winner of a prestigious Edward R. Murrow Award.
Welcome back to We Are Austin. Did you know that heart disease is the leading cause of death in the U.S.? Scary statistics, but today Dr. Robert Milman from Austin Radiological Association is here with what you need to know to reduce your risk, and we're glad you're here. Thank you for being here.
Well, thank you, Taylor. It's a pleasure.
So how do doctors figure out if someone is at risk for heart disease?
Well, first and foremost, your physician or healthcare provider will take a careful history and want to know whether you have risk factors such as family history of heart disease, whether you smoke, whether your diet is correct or not, and your level of physical activity. We'll also check your blood pressure to see if you have hypertension, which is high blood pressure. Do a panel of laboratory work, including a cholesterol level. There's both a total cholesterol, and then there's good and bad cholesterol. We'll check both of those. And if your risk is significant enough, may want to consider doing a sophisticated imaging test called the CT, coronary artery calcium score test.
Okay, so that's a bit of a newer term for me. How does that CT, calcium, let me get it, calcium score test, how does that work, and how does it predict the likelihood of a heart attack?
Right, absolutely. So CT, otherwise known as a CAT scan, is an imaging test that uses radiation to look inside the body and can look at the pictures on the screen there. We have some images from a coronary artery calcium score.
Okay.
The image to my left, which says with calcified plaque, shows what we look for. The white area that the arrows are pointing out is plaque in the wall of the artery that has calcified, where the normal artery pointing out on the right, doesn't have any of that plaque.
So this test, what does that feel like to get that test? Is it scary or painful, or how does it work?
Well, that's a great question. It's a real simple and painless test. Let me share a story. I visited my physician and had some risk factors for heart disease. Okay. So underwent the test myself. So from a personal point of view, I can share
Tell us exactly.
Yeah, even doctors go to doctors. So you lie on a table and go through a donut-type machine called the CT scanner. Right. Takes images of your heart and takes less than 5 minutes. There's no needle stick. There's nothing to swallow. There's no pain. You go immediately back about your activities.
Oh, wow.
After the test is done.
That's simple and straightforward.
It is.
Okay, good to know. So then, let's say you've had the test. What are the steps a patient can take once their risk has been assessed? What's the follow-up to that?
Right, so you'll follow up with your physician or healthcare provider and review the results of the test. If we find early warning signs of future heart disease, then we can institute corrective measures to try to prevent a heart attack in the future, such as encouraging you to change your diet, increase physical activity, stop smoking if you smoke. For those that have high cholesterol, there are some drugs on the market now that can reduce that if need be. And if your blood pressure is high, there's some drugs obviously that can reduce that too.
That's good, so that there are options out there. When you talk about the results, who is interpreting those exams?
Radiologists are physicians who are specialists in medical imaging, and we have a lot of experience looking at images of the heart and other parts of the body. So we will be interpreting the exam and getting the result to your doctor. To determine the actual calcium score, sophisticated software is used to help us do that.
And it's good to know that tests like that are out there so you can be proactive about your health and kind of detect things early. So where can someone go to do them, or to just reach out to you guys for more information?
Well, we'd be happy to help anyone with this test. We have 17 imaging centers in the Central Texas area, most of which provide this service. You do need a referral from your physician or your healthcare provider to have the test done, but any of our 17 imaging centers are happy to help.
Good. That's a lot of options. 17 you can get out there, or you can find them online, or just pick up the phone and call if you want to. Dr. Milman, thanks so much for being here, and thanks for the work you do to make sure people are happy and healthy and living long lives.